Aside from these chemical concoctions, advanced technology is also constantly updating available aesthetic and cosmetic treatments. Across town from George's practice, another procedure is about to take place.
Waterproof. Mine is not a green one. Mine is a...
The operating theatre has been prepped and primed for surgery, but there isn't a scalpel in sight. Vascular surgeon Dr. John Tan is at the helm of this operation, and in the next hour, he will go about ridding his patient, Madam Wong, of a... Varicose veins are steadily on the rise. If not treated, the condition can lead to skin ulcers and infections. And at the very least, they are unsightly, lying enlarged just beneath the surface of the skin.
If you look at this patient's leg, there are a few important things that you can see. First of all, patient come to me with all these bulgy veins. To her, it is ugly. She also complained of pain in this area. She complained of cramps at night. She feels the leg tires very easily. So in this case, we have already done the marking. Basically, this is the area that we're going to do the laser later on. You can see the vein is very big. Usually it's not so big.
Previously, the only way to remove varicose veins was through a process called stripping, where they were physically pulled out of the leg. This is highly invasive and painful. But that all changed with the advent of laser therapy. Vascular surgeon Dr. Tan offers a radical alternative to the traditional stripping method. The quick and painless procedure is known as Endovenous Laser Technique, or EVLT, and it's revolutionized his field of surgery.
What we will do is we will laser this vein, and most of this surface vein will actually resolve by itself. And those that don't resolve, we usually will give them some form of injection. Okay, usually we give the patient some local anesthesia in order to numb the skin around the region.
A needle is then placed into the lower end of the vein, through which a small sheath is inserted. And this is when the magic starts.
This is a laser fiber. You can see the light shining on the laser. And the laser fiber will go inside the catheter.
Laser energy is then delivered to the fiber, which causes the vein to close as the fiber is gradually removed.
Now we are done. We just have to put on the bandage. We usually put them on the compression stocking for about a few days. In our practice, we see about 30% medical patients who come to us with ulcers and pain, and we use the same procedure, EVLT and sclerotherapy, to treat them. 70% of our patients come to us purely because of appearance. They are not suffering because of the vein. They don't have too much pain. They just basically want to look better. It's an aesthetic procedure because we make the patient beautiful.
Although it'll take a few weeks to appreciate the full effects of the procedure, the varicose veins are already much reduced in size. With luck, this will be a one and only operation for Madam Wong. And even if varicose veins start to form again, it won't be for many years to come.
Okay, Madam Wong,